Well, I've been in a command position since 1989 in the Forest Service.
Plaques and pictures displayed inside Mike Lohrey's Fairview home mark a storied career as an incident commander.
National teams were immediately dispatched for major disasters, presidentially declared disasters.
His missions took him far and wide, responding to hurricanes in the east to battling wildfires in the west. One of the biggest missions took him and a team of 40 to Manhattan, New York.
This was a terrorist attack, obviously.
In the wake of 9/11.
10 days later, we were there.
For 30 days, they worked alongside New York's finest, setting up warehouses and stocking up supplies.
And it was a privilege because just helping out the people, especially the firefighters that are our brethren, helping all those folks out best we could.
Mike recalls Ground Zero, or the pile that continued to burn for days and days.
And if you went down there at night, you could see particles and dust all over the place.
The images of that time stayed etched in his mind in the years that followed, as health impacts began to show.
I wasn't diagnosed with it until fairly later, and then it went boom.
For Mike, it was fibrosis, lung disease.
Finding out more about the health issues, and 25% of the people that went with me to the World Trade Center are either have passed or have a disease similar to mine, or have cancer, or etc.
On oxygen 24/7, and with his condition quickly deteriorating, Mike needs a double lung transplant, one he hopes to get after undergoing a series of tests at St. Joseph's Hospital in Phoenix. But just getting to this point, getting pre-authorization for those tests, was infuriating and frustrating. They
move like molasses.
And slow. It took months for the right people to sign off.
Well, if you die if your time's limited, not my problem. They just don't care.
Those feelings directed at MCA Sedgwick, the contractor in charge of administering nationwide provider network services for the World Trade Center Health Program, focusing on the tens of thousands living outside New York.
The program is not health insurance. The program only provides limited benefits for certain conditions that the program will cover.
Benjamin Shavat, the executive director of 9/11 Health Watch, a nonprofit advocacy watchdog group, says in the short time that MCA Sedgwick's had the government contract, since late summer 2022, members have encountered a series of problems.
They couldn't answer the phone. They had wait times of hours. There were real problems with their network. Again, in the title, it's called the National Provider Network. And their network was not as good as the previous network. Lots of different issues in terms of service delivery.
Mike and his wife, Teresa, ran their complaints to the top.
And we had to go through their bosses. We had to go to CDC, hold their feet to the fire to get something done.
If Mike did not have me to advocate for him, he probably would not be getting even the evaluation for the lung transplant. He would not be able to fight the battles with Sedgwick.
And although their issues were eventually resolved, they worry for others who rely on this contractor for life-saving benefits.
Like pushing a rope up a hill.
In a statement, the CDC told KGW they are aware that some members in the nationwide provider network have experienced issues in accessing care in the WTC Health Program. The WTC Health Program continues to actively work with managed care advisors to optimize the service they are providing, resolve any member concerns, and ensure ongoing performance improvements. We never heard back directly from MCA Sedgwick. For Mike, a working set of lungs can't come soon enough. But when asked if he has regrets, if he wishes he hadn't gone, his reply,
no. Like I said, I'd do it again. even knowing the results.
In terms of getting assistance, the CDC encourages any member who is experiencing challenges getting care to contact the World Trade Center Health Program. That email is wtc@cdc.gov. There's also a number. We'll have that up on kgw.com. And the 9/11 Health Watch Group has a portal where you can contact advocates directly if you're having problems accessing this care. Blair?
Alma, thank you.